Wake up, folks, this ain't no drill. Grab your coffee, fuel the thrill. It's the podcast road to GP fame. Be an awesome GP is the name. Diagnose with style, prescribe with flair. You're a GP boss with skills so rare. Laughter's the dose, humor's the key. Tune in now to be an awesome GP.
Hello, awesome GPs. Once again, it's me, Dr. Christopher Timms, your traveling companion on the road to excellence in general practice. Today, I am just absolutely stoked. We have a very special guest. We have Dr. Katherine Holzhauser from the Kaleidoscope Clinic. Now, Kat and I first met at a Future Leaders Day, and she's number 3 in our Future Leaders series, where we sort of chat to the people I've been meeting along the way. Kat, welcome to the show.
Thank you very much, Chris. Pleasure to be here.
So I was really excited to get you on the show because there's a few of us working on projects related to ADHD and ADHD management, and everything just seems to have kicked off in the last 2 weeks after years of anticipated change. Why don't you give us an overview of who you are and what you're doing?
Yeah, cool. So I am a North Queensland local. I studied at James Cook University and have stayed local to the region. I graduated with first class honours in 2000 and forget the year now, 7, and was the 3rd cohort. And then I've done most of my training up here in North Queensland. I have worked across the public and private hospital spaces, and then decided I really wanted to do general practice because it allows you to be, I guess, the detectives in medicine. You're a true generalist, and no day is the same or ever boring in GP land. I've also worked for James Cook University as a senior lecturer and year 4 clinical coordinator in the past, and have been a practice owner previously. And then in 2022, I set up Upward Life Family Practice with fellow colleague Dr. Cameron Downs, another fellow local, with the goal of creating a great space to come as a patient and to work. And from just myself, we've grown to have 8 GPs and an attached allied health hub with 2 psychologists, another psychologist joining us from today, a child and adolescent psychologist in another month, a speech therapist, GP hypnotherapist, and then the Kaleidoscope Clinic from myself and another GP, recognizing the increasing need for specific, I guess, neurodiversity care, so across the ADHD and gender diversity space. And so we established that over the last couple of months and started in May. So I guess that's a bit of information about me and how we have come to be, or how I've come to work in this space.
And it's actually a real achievement in this environment for you to not only go into practice ownership, but to be thriving and to operating what is probably no longer a small business, but a medium enterprise. You're facing all the challenges of rural practice. You're facing the challenges of trying to integrate ADHD and neurodiverse care. And you seem to be, killing it, for lack of a better word. Let's drill into it. So let's drill into maybe what made you apply for Future Leaders first.
Yeah. What made me apply for Future Leaders? I guess in some respects it was what might that give me in the way of either contacts, but also supports and some formal education and understanding around, again, I guess, leadership and promoting what good GPs do in their communities, and perhaps how that can be applicable not only at the local level, but more generally at that sort of state or national level. Because again, while I'm a North Queensland local, I've lived in various different places, and every region has such different needs and like demographics and challenges. And so there can be a real difficulty in general practice to have a voice. And actually, we're in North Queensland, and people think that's maybe only a 2-hour drive from Brisbane. Actually, it's a 2-day drive, and we are far, far removed from the southeast corner. And what might be very accessible down there. You don't have a snowflake's chance in hell of getting up here. And so understanding of what has been really difficult to access in my region, specifically mental health cares of various descriptions, amongst other needs, but particularly mental health. And so looking at what that might be able to assist myself, my patients, and then I guess also broader the community. You know, what can I then apply to try and help, you know, do in my area?
And I think that's one of the beauties of rural general practice. And I'm spoiled now. I don't practice rurally. I'm in an urban setting, but the sheer enjoyment and excitement of being able to do more with less, and it's not necessarily a good problem, but when you do pull it off, my goodness, the patients love you for doing it, and you can deliver excellent quality care still. I must
Yeah,
say,
definitely.
I think everyone I've met at Future Leaders is doing exciting things, but it's really cool to talk about the ADHD level stuff. Obviously, down in New South Wales here, one, we lost to Queensland at origin, which is, that's fine. But two, the ADHD regulations have shifted massively in the last month or two. And from July, I believe we'll be able to prescribe continuations for kids um, at with less regulation and less compliance paperwork. And then eventually we'll be initiating in kids and adults over the next 6 to 12 months, which is a huge change. You guys have a slightly different framework in Queensland, although things may change by the time I get this out. What are you working with at the moment?
Yeah, so it's amazing how long it sometimes takes for changes that have been present for some time to even filter through to understanding amongst the clinicians. So in Queensland, and the difficulty is every state's different. So we really do need conformity across states in this space to assist, I think, clinicians and patients. But in Queensland, GPs have been able to initiate and prescribe medications for ADHD in the child population, specifically between the ages of 4 and 17. However, for the adult population, for those 18 and above, they still would need to have a review with a psychiatrist to then and at least make recommendations, which then I can apply for approvals at the Medicines Regulation Unit to then initiate and or continue prescribing. And then in the adult population, you have to apply every 2 years with or without a psychiatrist review. Potentially, you don't have to have a psychiatrist review if they're stable, and then we can continue to prescribe. So the challenge, I guess, is several fold. One is that in the child space, as a GP, and perhaps what also led to even look into working in this space was if you saw a kid, say, who's in grade 4 and maybe their older sibling or siblings have been diagnosed with ADHD and plus or minus mum or dad, and they're struggling with getting out of the house, dysregulation. The teachers have made comments like child not at potential or disruptive, or would do better if they applied themselves. And so often as GPs, we're the first port of call and the parents come in. And if you're from a more disadvantaged or socio-economic group and you don't have the means to see a private pediatrician, then if I refer someone to the public hospital and the query ADHD behavioural issue is the only factor, then that child may sit on a waiting list for upwards of 2 or 3 years. By which time, if they're in high school, the issues have compounded. You now may have associated mood disorders or low self-esteem, or what's the point of trying because I just get in trouble. And then you've got a very different scenario to if we had have been able to either do a diagnosis, put in some supports and strategies. And to be really clear, this isn't just about medications at all. It's around looking at supports and structures for the whole family or for the school, of which medication is merely a part of it. And then the opportunity lost over those several years can be significant to the child, to the family, and to the community. So there's an element there. And we do have more pediatrician access now, which is amazing. But if we go back 2 years, we had one pediatrician that was accepting private referrals in Cairns for a period of about 6 months. And if you're not familiar with, where Cairns is situated in Australia, have a look at a map. But we are the feeder from Torres Strait down. We are in a massive health hinterland region. So you can imagine if you've got one private paediatrician accepting referrals in that space for all paediatric conditions, you can imagine that they're swamped and they're unable to necessarily see patients in a timely manner. And yeah, so there's that aspect of it. And then the other part is for the kids that might be transitioning, they've been really stable under peds for some time, perhaps even in the hospital space, and then they are now adults, and suddenly you've got to get a diagnosis and an assessment. That still is a problem, but that is a real challenge, because we see these functioning kids that have left schooling, that want to go on to uni or further study. They can no longer access their meds. They can't afford to get an assessment just to continue what they have been on perhaps for many, many years. And then the wheels fall off, and they lose some of their opportunities. So I think there's a lot of space here to try and do things better. And hopefully with the changes in New South Wales and just announced this week in South Australia, and then hopefully the other states will follow, we can start to
Who's your
actually
pick for
help
next?
some of those. Oh, Queensland.
Queensland, yeah. Okay.
God, yeah. Exactly. And shut me up. I know I keep talking, so feel free to just cut me off if I'm just rambling too much. Yeah.
Because it is just stark. Like I put up my ADHD sub-interest hat maybe 2 years ago, maybe a little less. And in that time, the amount of particularly women in their 30s to 40s who have come forward, and there's about a 90% strike rate on diagnosis. Like about 90% of them did in fact have undiagnosed or missed ADHD. And the number needed to treat and the sheer quality of improvement of life is just, it's really amazing. And I really am looking forward to the future with what we're going to be able to do in general practice in this space. If I could swing back for a sec to Future Leaders, would you encourage others to apply for the program?
Absolutely. Yeah. It's been fantastic, with people I've met, such as yourself, and also with the opportunity to do some learning on specific, I guess, topics like what was it, leadership? So I sound like an idiot now, but I think it was leadership without authority, and
It's
and
very
just a few.
interesting.
So some of these things that perhaps we already do in our day-to-day, but to really formalize an understanding of and how to apply it in our clinical practice, as a GP practice owner, also specifically in that broader sense as well. So it's been invaluable learning to try and I guess hone some of those leadership skills at multiple levels.
So I know we're on a timeline. I know you're not only a successful practice owner, but you're a successful mum. You've got responsibilities, including the daycare pickup and all these things to attend to. Before we go, is there anything you'd like to put out to our listeners? Any comments you'd like to say, or anything you want to leave them with?
I think the really important thing at the moment is that as clinicians, doctors, especially GPs, it's essential to keep our clinical curiosity. And with ADHD and in this space, there's a real split amongst the profession, this sort of sense of, well, everybody's got a bit of ADHD and most people will probably feel better on stimulants. And so, it's just the in thing. And I think we need to be really mindful of what message that might send to either our colleagues, our friends, our families, if we do make those sort of offhand comments, perhaps without an understanding of the real harm they can cause, but also the real opportunity for individuals that, like you've said, might have actually put themselves out there to seek support or diagnosis, and the incredible benefits that I have seen and witnessed in patients where they have had the courage to seek out that additional support treatment. And again, it's not just about medications, but also the value that medications can bring. It's incredible. So I think don't be dismissive of the opportunities.
Thank you, Dr. Holzhauser. You are an awesome GP, and I look forward to next catch up at the next Future Leaders event. We'll leave it there, and you have a great day.
Thanks very much, Chris. You too.